Neuromodulators are medications that block the transmission of neurotransmitters to the muscle. So, how your muscles work, a nerve from your brain butts up against your muscle, the nerve tells your muscle to contract, and the muscle contracts. There are neuromodulators that block that communication. They block a substance called acetylcholine. So there's three main brands of neuromodulators. One is, they're all botulinum toxin. So the first to market was Allergan's Botox. And then there's also Galderma's Dysport. And the last one is called Xeomin. And these are all botulinum toxins. So I think the generic term people use is Botox, but there are different companies that make the botulinum toxin, and then they're all very good. One isn't better than the other. I think that what's most important is the experience of the injector. You don't need to use tons of this medication to get a good result. You have to be very accurate about the placement, and you have to relax muscles and modulate muscles that are appropriate. The most common areas treated with neuromodulators are really around the periorbital area. So the area between the eyebrows, or the glabella. There's some muscles there that we sometimes contract when we're concentrating or reading. And those muscles often cause vertical lines, which can make people look a little more stern than they might look. Forehead wrinkles, which are caused by contraction of the frontalis muscle, those can be relaxed with Botox as well, and that causes a smoothing of the forehead. Also crow's feet wrinkles, those are very common. We also use it in the perioral areas to do a lip flip. Even masseter muscles, which can sometimes make people look a little bulky along the jawline, can be reduced with Botox. Some of the more specialized areas would include shrinking of glandular tissue, so parotid and submandibular glands can be shrunken with Botox. So there's lots of different uses for the medication in a cosmetic practice like ours, and our nurses have years and years of experience with this. They're excellent injectors. They train other physicians and nurses, and I really trust them with our patients.